Ready, go.
I'm Claudia.
I'm Mason, and we did our table clinic on the Lightsaber of Dentistry.
So dental lasers are modern technology that continues to advance and is incorporated into everyday practice in dental offices today.
Dental lasers are an evolving technology that are used for various types of procedures. The term laser stands for light amplification by stimulated emission of radiation. So lasers produce energy through thermal reaction, so they create heat, and that heat is absorbed into tissues to perform their procedures. There's 4 common types of lasers. There's the ND-YAG, which penetrates soft tissues and performs procedures like gingival troughing and treats oral ulcers. Then there's the erbium, which is used mostly for caries removal and tooth preparation for restorations. There's a diode, and that's used on soft tissues, mostly in cutting gingiva and mucosa and for sulcular debridement. And there's a CO2, which is also used for soft tissues, and it's mostly used in the treatment of mucosal lesions.
So then we found some procedures and their results when they used the dental lasers. The first one was a 21-year-old patient presents with a periapical cyst and an incomplete endodontic filling. So what happened was the cyst was removed, and then it was sterilized with the dental lasers, and then it was ready for the endodontic treatment. Another procedure was with low-level laser therapy, and it was used for the treatment of erosive lichen planus. And the laser helped with things like vasodilation, lymphatic drainage, activation of fibroblasts and neutrophils, and it also decreased any pain and inflammation that the patient had. And using the low-level laser can also reduce any reliving signs of oral lichen planus. And then the last procedure, the low-level therapy, was also used to treat an oral mucositis, which is considered the most painful oral lesion. So the application of the low-level laser has shown a significant reduction in the pain associated with the oral mucositis, and it also helps with quicker healing of the lesion. Some other procedures that the dental laser can do is it can remove discolorations on the veins and lips, like melanin pigmentation, implantology, prosthodontics, endodontics, oromaxillary surgery. It can detect early carious lesions, and it can expose unerupted teeth.
So some benefits of dental lasers are it provides detoxification effects, so by sterilizing the area. It can be used in many different types of procedures. Little to no anesthesia is required because the laser doesn't ever contact the tissues, so your body doesn't release histamine, which makes you feel pain. They're minimally invasive, sterile. The patient will experience minimal bleeding, so they will have quicker healing. The patient will also have a lot less discomfort after operations as opposed to traditional methods. There's a decreased working time for the dentist or hygienist because they don't have to provide local anesthesia or topical and wait for that to take effect on the patient. And then it's widely accepted by the patients.
And then some cons of dental lasers are the high cost of it, and then there isn't really education on dental lasers.
There's not a lot of institutions that provide that type.
Yeah, and then any safety hazards, and then possible tissue damage if the laser is used wrong, in the wrong way, and then aerosols, and especially with COVID, that's a big thing now.
Yeah, so overall I think there's a lot of benefits to incorporate dental lasers in everyday practice. Unfortunately in Ohio, hygienists are not able to use lasers, but with state regulations, Arizona, Arkansas, California, Colorado, Hawaii, Iowa, Kentucky, Nevada, New Mexico, New York, Tennessee, Texas, Utah, Virginia, Wisconsin, and Wyoming, their hygienists are allowed to practice with lasers there. Hygienists in those states have reported that using lasers has made their practice much easier and more efficient. And here are our resources.
Okay,
Okay.
I'm gonna turn this off.
Yeah.